طيب، بسم الله الرحمن الرحيم. موضوعنا اليوم هو واحدة من أهم المواضيع بالسيرجيكال براكتس in terms of patient's care, in terms of improving the outcome of surgical service. And we study كل factors that improve the service provided to our patients, and we are trying always to improve the outcomes. واحدة من أهم outcomes that we measure and do want to control in the post-operative period is the surgical site infections. These are one of the most important complications causing morbidities and mortalities for our patients, as you know. And we will define hospital associated infections, define the surgical site infections, classifications of wound will be elaborated here in this lecture. Care bundles, we will talk about the things that we do require and recommend during surgical practice in order to improve the outcomes and decrease the risk of surgical site infections. And we will talk about the antibiotic prophylaxis and use in the surgical practice. Good. Now, the hospital-acquired infections, what we call nosocomial infections, are the infections that occur after 48 hours of admission. Yani, patient presents without infection and then develops this kind of infection after hospitalization at least 48 hours. ممكن يكون مريض عنده other type of infection لكن مش اللي عم نحكي عنه. يعني ممكن مثلا مريض يكون عنده pneumonia, it's not nosocomial infection. ممكن يكون عنده مثلا زي بنسميه community acquired pneumonia. يدخل على المستشفى after around 48-72 hours develops sepsis. هلا إذا السبسس هذا due to pneumonia, this is not called hospital acquired infection. لكن إذا كان السبسس مثلا due to line, يعني مثلا واحد حط لنا له central line أو حطينا له Foley's catheter that causes urinary tract infection أو sepsis due to the line infections زي ما حكينا, this is called nosocomial infection. طبعا ليش بهمنا؟ لأنه زي ما حكينا to improve the service, to improve decrease in morbidity and mortality for our patients, to improve the quality of health service, و decrease the cost, decrease the hospital stay, increase أو enhance the recovery and return to work. كلها هذه factors that motivates us to improve the outcomes, to decrease the risk of surgical site infections. Again, please, صوتي واضح. أنا عملت لكم active mics. إذا حدا يجاوبني بس.
واضح.
ممتاز، شكرا. Good. So هذه تعريف hospital acquired infection. Now, the hospital acquired infections, they are of many types. الأكثر إشي بهمونا هم اللي رح نحكي عنهم surgical site infections. في other types like the urinary tract infections اللي هو catheter related infections يعني, cannula أو line infections اللي بتعمل sepsis زي ما حكينا, مثلا ventilation associated pneumonia, respiratory infections. These are examples of nosocomial infections. Now اللي بهمنا الآن نحكي عنهم هم surgical site infections. Now, what's the volume of the problem? يعني تخيل قديش مثلا في اليونايتد ستيتس per year أكثر من 300 ألف حالة. يعني بنحكي عن 5% around 5% of patients undergoing surgery increasing mortality causing mortality in 3% of these affected patients. يعني 3% من هذول المرضى اللي بصير عندهم surgical site infection they die. طبعا they increase the risk of death in any patient undergoing major or minor surgery, especially major surgery. And deaths are in these patients is due to the surgical site infection. يعني إذا مريض مثلا عامل cardiac surgery أو مريض عامل lung surgery أو مثلا GI surgery and post-op he developed this surgical site infection, the death is mainly from the surgical site infection, it's not from the surgery itself. Although the surgical site infection is a complication of the surgery, but I mean يعني مثلا مريض اللي راح يصير عنده infection مثلا ما راح يموت من أريثميا، راح يموت من سبسس إذا عامل cardiac surgery. ما راح يموت من heart failure، يموت من sepsis إذا عامل valve surgery. Okay. Length of hospital stay increased زي ما حكينا hospital stay increased cost increased hospitalization, delayed recovery, delayed discharge, delayed return to work, and more short and long-term disabilities. So it is of significant impact in the surgical practice. Now زي ما حكينا بهمنا نحكي عن surgical site infections. Now السيرجيكال سايت انفكشن نقسمهم الى انواع حسب الدبث. You know انه في عندنا سكن subcutaneous tissue عندنا اللي هي هذا الفات نسميه superficial fascia، وفي عندنا deep fascia overlying the muscles. هلا to make things easy اي شيء فوق الديب fascia بنسميه superficial infection. أي شيء تحت الديب fascia بنسميه deep infection, deep incisional surgical site infection. So again, superficial incisional surgical site infection is an infection occurring in the skin subcutaneous fat within 30 days after operation, involves only skin or subcutaneous tissue of the incision. If this extends beyond the deep fascia اللي overlying the muscle نسميها deep soft أو deep incisional surgical site infection. لا دائما تعريف 30 days إلا إذا في prosthesis. هذا التعريف will be extended up to 1 year. يعني أي infection بيصير up to 1 year نسميه surgical site infection. هلا beyond the muscles, the fascia and muscles, we go into the spaces and like the peritoneal space, like the pleural space. هذه نسميها organ space surgical site infection. So هذول حسب الاناتومي حسب الدبث superficial, deep and organ space surgical site infections. Now we classify wounds according to type of surgery into 4 types: clean, contaminated, and dirty infected. So تصنيف هذا بيعتمد على type of surgery. This is very helpful in predicting the risk of infection, dictating management in terms of the use of antibiotics, and the prediction of the risk of infection. So in clean surgery, the risk is very minimal, so we don't give antibiotics except for few exceptions راح نحكي عنهم. Class 2 اللي هم clean contaminated we give prophylactic antibiotics, and in dirty infected ones we give therapeutic dose of antibiotics شو الفرق بينهم رح نحكي. طبعا هذول الوونز طبعا according to types of surgery في لهم شروط. عشان نحكي clean لازم مثلا يكون clean surgery, elective surgery, not traumatic, يكون there is no break in the aseptic technique, neither minor nor major break in the aseptic technique. There is no entering into any of the cavities, لا respiratory ولا alimentary ولا genitourinary. There is no spillage of any contaminations. Everything is okay. Okay, this is clean surgery. مثال عليها مثلا الهرنيا بالأطفال. We do herniatomy. We just ligate the hernial sac and that's it. We don't give prosthesis. The area is clean. There is no entering to any of the hollow viscous. مثلا thyroidectomy is considered a famous example of the clean surgery. Clean contaminated is the first step of getting contamination. Either you enter a clean or a prepared tract, and there is no gross contamination or gross spillage of the contents, no infection encountered، يعني ما في abscess مثلا، ما في major breaks in the aseptic technique, some minor breaks probably. يعني مثال عليها مثلا واحد بيعمل elective laparoscopic cholecystectomy. This is called clean contaminated. You entered or you encountered the hollow viscous, which is the gallbladder. We ligate the cystic duct. So this is called a clean contaminated surgery. In this case, the risk of infection is slightly increased. So we give prophylactic antibiotics. Now, in contaminated surgery, operation following open, fresh, accidental wounds, a major break in stent technique, there is entering of hollow viscous with gross spillage from the GI tract or genitourinary tract, or there is acute non-parent inflammation. كل هذول أمثلة على contaminated surgery. This is the second stage of contamination after the clean contaminated. Also in this case we give prophylactic antibiotics. The fourth type, as we said, is the dirty, infected wounds. In these cases we involve all traumatic wounds, retain the vitalized tissues, infection, perforated viscous. يعني واحد عنده مثلا perforated diverticular disease، واحد عنده purulent appendicitis يعني peritonitis due to appendicitis، pus in the abdomen or fecal peritonitis. كل هذه examples of dirty contaminated. In these cases, as we said, we use not only prophylactic but therapeutic. يعني إنه الفرق prophylactic extends only for 24 hours. Beyond 24 hours, this is called therapeutic dose. This is what we have said before. Clean, contaminated, dirt infected. The risk significantly increase from around 1% up to 30 or sometimes 40% risk of surgical site infection in the dirty surgery. Risk factors for the surgical site infections. طبعا في many factors we will come across the most important. لكن هذول زي ما حكينا بنقسمهم إلى different classifications. Some of these are operation dependent factors. مثلا body temperature, antiseptics, duration of surgery, antibiotic prophylaxis, ventilation system, foreign bodies, drains, technique, hemostasis, etc. Some of these are patient related factors, like risk factors in the patient, like the age, the comorbidities, diabetes, some smoking, steroid use, malnourishment, obesity, and some other factors like immune suppressed status. So زي ما حكينا هذول risk factors are patient related or procedure related or operation related factors. Many factors are playing roles in the process. So we come across the most important risk factor, independent risk factor اللي هو ايش three independent variables associated with surgical site infection هم type of surgery, I mean being contaminated or dirty infected wound, ASA more than 2, and length of operation more than 75th percentile of the specific operation being performed. شو معنى هذول؟ أول شيء أول واحدة حكيناها سهلة اللي هي type of الwound، إنه إذا كان contaminated بيكون أعلى الريسك كل ما زاد degree of contamination. الثاني اللي هي ال ASA score. ASA score اللي هي ال American Society of Anesthesiologists. They classify the patient before surgery into grades type, let's say class 1, 2, 3, 4, etc. According to the status of the patient. Is he young, medically free, or having morbidities, uncontrolled morbidities, moribund patient, إلى آخره. هذولا ASA more than 2 is significantly increased risk of wound infection. الثالثة اللي هي duration. دائما duration of surgery is an independent variable. بمعنى انه مثلا اذا مريض بده يعمل مثلا cholecystectomy should take like around like 30 minutes. So if it takes like 3 hours, then definitely this will increase the risk of surgical site infection in these patients. Okay, now a few points about the antibiotics use and the surgical practice. Operative antibiotic prophylaxis is used to decrease bacterial counts at surgical site. بمعنى إنه we need time, I mean a time of call of surgery like 2-3 hours before incision. We give or administer the IV antibiotics in order to have enough tissue level at the surgical site. يعني مش at incision نعطي antibiotics, should be given like 2 hours or 60 minutes at least before surgery. ليش؟ زي ما حكينا لأنه الهدف منها إنه at time surgery, during surgery you should have, or we aim of having enough or best tissue level of antibiotics. This is achieved by giving the antibiotic 1 to 2 hours before surgery. طبعا حسب تفرق بين pharmacokinetics between the antibiotics, like usually around 2 hours. It is recommended to repeat dose after long surgeries, and زي ما حكينا by default prophylactic antibiotics are given for up to 24 hours, not more than that. If you extend therapy more beyond 24 hours, then this is not prophylactic. This is therapeutic antibiotics. Now, what kind of antibiotics you give? This is something important you should take into consideration. According type of surgery, I mean, are you operating with the colon? Are you operating on the stomach? Are you operating with the heart? On the lower limbs? طبعا بمعنى إنه هذا بيغير specific or possible pathogens that may cause surgical site infection. Definitely, the pathogen that causes surgical site infection in dental procedures is totally different from pathogens causing surgical site infection in colon surgery. So depending on the type of surgery and the possible pathogen, antibiotic resistance. I mean, some centers, some hospitals, institutions, they, of course, all of them should do that. They run studies to detect rate of infections and types of infections. طبعا surgery specific يعني for each surgery they do this test and they test for antibiotic sensitivity. I mean مثلا إذا مرضى مثلا knee replacement, they do replacement of the knee and they put prosthesis. They test أو خلينا نحكي they calculate the risk of أو incidence of surgical site infections وبالتالي بيسجلوها. بعدين they study what's the most common pathogen. وهذول pathogens are they sensitive for the usually used antibiotics ولا they are resistant. طبعا إذا كان في resistance you change the antibiotic used in prophylaxis for the same surgery in the future. أكيد طبعا كل هذا كلام لازم يكون along with the use of all precautions to decrease the risk of surgical site infections. زي ما حكينا هذه مثلا مثال على واحدة من ال instructions يعني recommended use of antibiotics in one of the institutions. بغض النظر وين، مهم إنه حسب type procedure في عنا antimicrobial agent اللي used for this. طبعا في different options بالعادة بيكون. ليش؟ لأنه أول شيء ممكن يكون في resistance. فمثلا إذا في resistance للسيفالكسين we change that, we go to the next step or more potent antibiotics. الشيء الثاني إنه مرات بيكون ال patients they are مثلا sensitive. مثلا إذا مريض يعمل vascular surgery he's sensitive for vancomycin, sorry for cephalosporin, you go for vancomycin. And etc. So you use specific antibiotics according to the type of surgery, resistance, and sensitivity, and probably if there's allergy in these patients. We said we'll be talking about some of the core strategies and the supplemental strategies. These are strategies used in surgical practice to decrease the risk of surgical site infections. زي ما قلنا في core في supplemental. Core they are with high levels of scientific evidence, demonstrated feasibility, while the supplemental strategies they have less خلينا نحكي solid evidence of efficacy in surgical practice. We'll start with the core strategies. في طبعا دائما في core pre-operative في there's pre-operative measures في intraoperative وفي post-operative. بلش بال pre-operative measures اللي هي أهمها زي ما حكينا prophylactic antibiotics. When and how to use prophylactic antibiotics 1 hour to 2 hours before surgery. زي ما حكينا مرات بيختلفوا حسب الانتيبيوتيك لأنه بيفرقوا حسب الفارماكوكاينetics. كل الهدف إنه to have issue to have tissue level enough, maximum tissue level at time of surgery. طبعا agents should be chosen according to the surgical procedure, the most common surgery site infection, pathogens, and the recommendations published. طبعا كل هذا adjustable حسب resistance حسب allergies. In addition to prophylactic antibiotics, remote infections should be treated whenever possible. يعني مثلا المريض بده يدخل يعمل valve replacement like the mitral valve replacement. If he has urinary tract infection, it's better to treat his urinary tract infection. أو مثلا عنده pneumonia أو عنده bronchitis, whatever. So in addition to the improved outcome after optimizing the patient in these from infection, this will increase treating infection will decrease the risk of surgical site infection. What about hair removal before surgery? Recommended is to do not remove hair at the operative site unless it will interfere with the operation, and do not use razors. If necessary, we use the clipping and depilatory agents. Skin preparation should be done with appropriate antiseptic agent and technique for skin preparation. Body temperature is a very important core strategy to be maintained during surgery. ليش؟ لأنه ال body temperature is a very strong, effective factor to decrease the post-operative comorbidities. إذا المريض develops hypothermia, if your patient develops hypothermia, this will increase the risk of bleeding, infection, and cardiac events. Good. هلا intraoperative measures كمان في عندنا الترافيك OR traffic. يعني طبعا this should be maintained by any mean as possible يعني as we can. يعني للأسف مثلا زي ما أنتم بتشوفوا مثلا هالأيام بالعمليات لما بيكون أعداد الطلاب كثير كبيرة وبيكون في ناس مثلا طلاب تخدير وطلاب جراحة وبيكون في visiting مثلا أو elective residents وممرضين وجراحين وتخدير. يعني بتلاقي جوا العملية غرفة العملية في طبعا بجوز فوق 20 واحد. and this is wrong. النمبر الترافيك this personal equipment كل هذه should be controlled to decrease the risk of infection. Post-operatively طبعا it is recommended إنه the wounds should be covered with dressings to protect primary closure incisions with sterile dressing for 24-48 hours. Post-operative measures also include blood glucose levels. طبعا هذه واحدة من أهم يعني الفيلدز اللي صار عليها debate وريسيرش بالسنوات الماضية اللي هي blood sugar control. At first we discovered that blood sugar control improved the outcome, decreased the risk of infection. So we aimed at decreasing aggressively the blood sugar. فكنا بالأول نعمل شيء بيسموه tight blood sugar control, aiming at having normal glycemia. بس طبعا هذا كل الaggressive management may lead to attacks of hypoglycemia and بالتالي morbidity and mortality. So nowadays the recommended is only to have like a nice sugar control, maintaining blood sugar less than 200 post-operatively, and this will significantly decrease the risk of surgical site infections. These are the core infections. Now talking about some of the supplemental, we don't have that strong evidence of scientific evidence, so يعني highly recommend them. مثلا nasal screen and decolonize staphylococcus carriers undergoing elective cardiac and other procedures. مثلا screening for يعني nasal screening for staph aureus. التايت sugar control زي ما حكينا it's not recommended. redosing antibiotics is a supplemental strategy. يعني مثلا إذا في عندنا lengthy procedure واحد يعمل major مثلا resection hepatobiliary resection مثلا أو gastric أو duodenal resection that may last up more than 3-4 hours. It is recommended after 3 hours of surgery to give a second dose of antibiotics to decrease the risk of infection. الشغلة الثانية اللي هي antibiotic adjustment according to the weight, and especially in obese patients. We have the obese patients who have their BMI is more than 30. So we have the formulas to adjust the weight. I mean, we can have the ideal weight and the actual weight, and we can calculate the adjustable body weight. Accordingly, we calculate the better, ideal dosage of antibiotics. طبعا surgeon specific infection rates. Feedback of surgeon specific infection rates. This is very important because of many factors. We'll talk about them that can vary between different surgeons. The rates of surgical site infection due to many factors. طبعا what are the pathogen sources? You should know إنه في عندنا two major sources, either endogenous يعني من the patient himself, either flora of the skin or mucous membranes or the tracts that we enter during surgery, or exogenous from outside يعني يعمل from his body or from outside his body. Outside like the surgical personnel, the instruments, inadequate hygiene إلى آخره. The more you go towards contaminated or dirty surgery, you know most likely in the cause of pathogen is, or the source of pathogen is endogenous. While if you go more toward the clean surgery, you think the source of infection is exogenous. Good. طيب, what's surgical site infection? We talked in general. Like, what are the most commonly encountered pathogens? طبعا, if you want to think about one and only one, it's gonna be Staph aureus. This is the most commonly encountered pathogen in surgical site infections. طبعا, luckily until now, Staph aureus are methicillin sensitive, but there, as you can see, there are rising numbers regard to methicillin resistant Staph aureus. شو مشكلتهم هذولا؟ هذولا associated increased morbidity, increased mortality, increased cost. يعني they worsen the outcome of the surgical service. Increase length of stay, delay recovery, delay return to work. Again, وحكينا عن the importance timing of surgical and antibiotics. يعني less than 2 hours before incision. طيب, قلنا قبل شوي إنه في شغلة تتعلق بالسيرجيكال أو feedback of surgeon specific rates of infection. ليش؟ يعني في فرق بين الكوليكتومي اللي بيعملها فلان على الكوليكتومي اللي بيعملها فلان، أو الابندكتومي أو الكوليستيكتومي يعملها فلان على فلان. Yes, there might be factors. ليش؟ لأنه كل هذه تتعلق بالسيرجيكال تكنيك. بمعنى إنه if you stick to the rules of surgical technique, basic surgical skills, the surgical principles, then you are not causing increased risk of infection. If you are not, then you put your patient at increased risk of having surgical site infection. For example, in surgical principles includes removing devitalized tissue. Any necrotic tissue, any foreign bodies, any devitalized tissue should be out. You maintain effective hemostasis. Hemostasis is very important because If you have improper hemostasis, then you'll have hematoma postoperatively. This is a media for infection. Tissue handling during surgery. If you are handling tissue improperly, you are traumatizing tissue, you're causing increased ratio of or increased chance of getting these devitalized, وبالتالي increase the risk of infection. Eradicating dead spaces is very important to be done, because if you leave dead spaces, you leave a chance to accumulate some fluids like seroma or hematoma, which will increase the risk of infection. And inadvertent accidents like entering hollow viscous, contamination from outside, improper use of drains and sutures. Another important thing to be mentioned اللي هي الاكسس او البروسيجر types. بمعنى انه you can do open and you can do laparoscopic surgery. Both same surgeries are done with same steps but with different techniques. So you can do a colectomy or gastrectomy or whatever. It's well known nowadays in laparoscopic surgery is associated with decreased or minimal risk of surgical site infection compared to open. So these are surgical specific factors. Now keep in mind دائما انه في حكينا control لل OR traffic, لل OR ventilation, لل OR temperature. I think that's the most important things to be mentioned. If you have any question, I'm happy to answer. عندي سؤال حابب تفضل. شهد.
يعطيك العافية دكتور. بدي أسأل إنه شو الفرق بين الكونتامينيتد والديرتي؟ إيش اسمه؟ نسيت إيش هم، بس هم الكونت وونز الديرتي والكونتامينيتد.
يعني هي ال degree of contamination is different. يعني مثلا هلا إذا مريض is not prepared، يعني إحنا دخلنا نعمل مثلا small bowel resection. هلا إذا قصينا small bowel is usually has sterile content، يعني content تبعته ما فيها هالبكتيريا اللود. we can resect the small bowel، هذه بنسميها clean contaminated. هلا مثلا inadvertently يعني unintentionally عملنا مثلا injury للكولون. اوكي، هلا اذا الكولون هذا صار في gross spillage of some stool around the injury، هلا بطلت clean contaminated، صارت contaminated. اوكي، هلا اذا مقارنه بمثلا بمريض عامل RTA او عنده stab wound بالابدومين، you opened his abdomen already, the stab wound opened his colon, his abdomen is full of stool all over. This is called dirty contaminated.
تمام دكتور، يعطيك العافية.
هذا ثاني بحب يسأل.
يعطيك العافية دكتور، ممكن سؤال؟
تفضلي.
ايش العلاقة بين ال level of glucose و susceptibility to surgical site infection؟ بصراحة ما عرفت أفهم.
Yeah. هلا not go into deep details، بس أولا هذول المرضى اللي يعني you do surgery for them if they are diabetic patients for many reasons. they have low immunity because of changes in macrophages, changes in the vessels. So this will be reflected on their immunity status, الشوجر كنترول. الشيء الثاني انه ليش البيري اوبراتيف شوجر كنترول بحسن هذا الشيء because of increased metabolism, probably because of the probably high sugar level in these tissues will encourage or enhance the bacterial growth.
تمام، شكرا دكتور.
اوكي طيب، شكرا جميعا لكم وألف عافية.
يعطيك العافية دكتور.